If you're a fan of the show, you may know that we don't do a lot of, new poll coverage. We're not a poll-driven show. That said, every once in a while, one comes along that tells a big story. A new Quinnipiac University poll released today says that only 38% of Americans approve of the health reform plans being considered in the Senate right now. That is a low number. But what Americans apparently do like is the idea of a public option. According to the same poll, 56% of Americans still say they want a public option. They want the option of a government insurance plan to compete with the private insurance industry. The public option has, of course, been consistently popular, even in red states and conservative states where members of Congress haven't supported it. Through all the debate, through all the ups and downs, through all the screaming and shouting and hyperbolic sign-wielding that dominated, say, the month of August, the American public has been and remains in support of the public option. And so, naturally, Democrats are reportedly dropping it from the Senate's version of health reform. Honestly, though, what was left of the public option after all of the compromising and the watering down was a fairly puny policy. And we knew that even 6 weeks ago. 6 weeks ago, we talked at length on this show about what the public option had been negotiated down to. You may remember I even used this big sign to illustrate what little was left of what we thought of as the public option. Even back then, it looked like it would only be available to people without insurance, and that it probably wouldn't be available at all in some states. The one saving grace for the public option, when we talked about it 6 weeks ago, was that at least the public option at that point wasn't going to be attached to a trigger. It's the public option maybe someday. This is the triggered public option that only kicks in if certain yet-to-be-determined goals aren't met by private insurance companies years down the road. Where we ended up today is not the trigger. So not maybe someday. We didn't get the most conservative of all those options. What we got was a public option that's only available to uninsured people only in some places. That's where we stood 6 weeks ago. And now, the public option has been whittled down even further. NBC News reporting that according to the deal struck by Senate Democrats last night, if we do have a public option now, I'm going to have to go find that thing I threw across the studio 6 weeks ago. If we do have a public option now, it's going to have a trigger. The maybe someday trigger that was the one further watering it down compromise they hadn't given away at that point. Now they've given that away too. So given the fact that the public option is now officially almost meaningless, why would anyone, much less 56% of the American public, still be hot for it, still be all excited about it? Why would people still be hanging their hopes on something that would really only affect about 1% of the population? It would only be available to uninsured people, only in some places, only if a complicated series of events were to trigger it, which would be very unlikely. Why are people still so enthusiastic about what has become a teeny, tiny little idea? Maybe it's because the nitty-gritty of the public option is hard to explain. And maybe what people really like and are attached to is just the idea of having an option for health coverage that's public. The elephant in the room here is that there are already a lot of public programs providing health care in this country. And they're very popular, and they work. And surveys consistently show that Americans are more satisfied getting their health care through these existing public programs, like, say, Medicare, than they are with what's being bought and sold on the private for-profit market. So rather than have a public option, which essentially does nothing, what about just expanding the existing, popular, long-standing public programs that we have now? The Senate Democrats' new compromise reportedly includes a provision to allow Americans to buy into Medicare 10 years earlier than people can get it now. So they'd be starting at age 55 instead of 65. Why not 50? Why not even younger? Medicare is the program for older Americans. Medicaid is the program for disabled and low-income Americans. What if Medicaid was expanded to cover people with incomes 4 or 5 times the poverty level, instead of the patchwork of eligibility requirements that exist right now? What about building up existing working programs like those? Or like S-CHIP, the successful, popular kids' health insurance program that President Obama already expanded from covering about 7 million kids to more than 10 million currently covered. These are programs that already exist. They are not new or experimental. They are tried and true. We know how they work, and the people who are enrolled in them tend to like them. Could this be the simple key to what has otherwise been a pretty puzzling political process? Could we solve the health crisis just by building on what works? If so, I doubt that the public option is going to get a particularly teary funeral from a lot of liberals. Joining us now is Congressman Anthony Weiner, Democrat of New York. Congressman, thank you very much for coming on the show. It's nice to see you.
It's my pleasure. Thank you.
You're a progressive. You have supported Medicare for all. After what we've seen a big rightward drift in the health reform debate over the last couple of months, are we now closing in on something that you think you could support?
Oh, I certainly do. I mean, let's remember something. The public option is something of a contrivance and a compromise for people like me who believe that, look, we've had an experiment for the last 44 years in health care for those over 65, and it's worked. It's low overhead. You don't have to worry about profits. 96% of all people on Medicare say that they like it. Well, why did we come up with the number 65? Why not 55 or 45, like you said in your introduction? You know, I think we would have made a much smarter decision to begin with Medicare and grow it. People understand it. You don't have all the confusion in town hall meetings. And you don't have that weird schizophrenia in my Republican friends who say we're against public plans, but we like Medicare. So I think this is not the camel's nose under the tent. This is his head, his neck, and his shoulders towards what we really should be doing, is thinking about how we take that Medicare experience and expand it to more Americans.
I'm going to get a little hardball here in the sense that just talking about the hard-edged politics of this. It seems to me like if liberals were really good negotiators, liberals would be crying and marching in the streets right now talking about how awesome the public option is, how much they're going to demand the moon and the stars in return for being forced to give it up. That's not happening. A lot of liberals, myself included, talking openly about the fact that the public option had been whittled down to be something almost useless. Is this a bad negotiating tactic?
Well, I got to tell you, part of the concern that I'm concerned about, I want to make sure that my progressive friends, and I'm really not sure who it is that you can say really supports Medicare. It's broadly supported across the political spectrum. Even my conservative Republican friends who opposed it when it was created say that it's such a great thing now they don't even want to cut $1 out of it. But the most important thing that we need to keep in mind what our values are and then let someone else decide what the politics are. We started this debate by saying we need to have more affordable coverage for more Americans. Well, Medicare is a great place with its 1% overhead to start. If John McCain and John Thune want to hold a press conference attacking this proposal because I like it, well, that's fine for them, but I think we should keep in mind what we've tried to do. This is going to be a success if we expand a program that works. And isn't that what we always say in Washington? Let's take what worked and build on it. Let's get rid of what doesn't. We were all negotiating about what to do if we can't expand Medicare. Well, now we're back at that place. I'll let the politics take care of itself because I think this is good policy.
On the issue of Medicaid, which is, as we said earlier, for disabled and lower-income Americans, one of the pieces of common wisdom about policy in general is that programs that are intended just for the poor tend to be poor programs because there aren't a lot of people with a lot of clout to complain and get improvements when they are not well served by these programs. Would Medicaid get better by force if more middle-class people were in it?
Well, this is an example where the House bill is a lot better than the Senate bill. We do two things to make sure that Medicaid doesn't become a dumping ground. Two, we increase the reimbursement rates for doctors, so it's not just such low reimbursement rates that no doctors want to be in it, and the quality of care is diminished. And secondly, we don't dump all the responsibility on the states to fund half of it the way it is now. We have a race to the bottom in a lot of states that since the states have to pay for half of Medicaid, they have a way of diminishing the services. But I think that ultimately what we should have is Medicare for all Americans, and that is people of all incomes, of all age groups. That's the way we should do it, a single-payer system that takes out the profit, takes out the overhead, and says, listen, we're already giving our money to doctors. Why are we giving 25 and 30% to insurance companies for their profits? And that's why Medicare has been a success. We have a financing problem that can't be overlooked, but at least we know money going into Medicare is actually going to patients.
Congressman Anthony Weiner, Democrat of New York, thank you so much for joining us tonight. You are one of the clearest, most clear-spoken people on this issue, inside or outside of Washington. That's why we've had you on so frequently to talk about it. Thank you.
Thank you.